Hello, Dr. Subhash. I welcome you to the brief telephonic conversation. I am Bhartesh from HealthWish.
Hello, thank you for having me in this conversation.
Doctor, my first question would be, for a common patient, how safe are hospitals to be visited during corona scare?
Usually, hospitals are safe to visit during this time, but right now, most of the hospitals or healthcare centers treating only patients with emergency complaints, and
Okay.
only a few hospitals which are in green zones or have started their normal services. But I recommend is that if you want to visit just for general checkup or anything which is not an emergency, I recommend that you should call your doctor or the hospital and confirm whether they're able to give an appointment. Before visiting, you should wear a mask while going out, I think you know. And there will be temperature checks with the hospital. And if you are suffering from specific symptoms like fever, cough, or cold, the government has set up a specialized fever clinics in your ward or in your area, or it is a small place like in your town. So you should go and visit that specific clinic for these kind of symptoms. So they'll make a diagnosis and they'll redirect you to specific hospital or treatment center.
Okay. Please explain me the sterilization practices followed by the hospitals.
Okay. See, usually we or any other hospitals as such follow the safety protocols or the standard which is recommended by the government or ICMR. It's Indian Council of Medical Research to ensure the safety of our hospital staff and the patients.
Okay.
We won't allow more than two persons inside the hospital. If a patient is coming, we allow only one person with the patient so that there will be less infection rate if in any case. And you know that social distancing is a must inside the hospital or anywhere. Our staff or the doctors, we wear basic PPE such as masks and gloves. And coming to the sterilization part, we disinfect the premises or most patient sensitive areas with there is a specialized liquid disinfectant. It's a combination of bleach and alcohol.
Okay.
Usually we use ethyl alcohol. We'll disinfect daily once, like in the evening or in the morning before we start the OPD. And surfaces like the tables or anything, pads or anything, we make sure that they'll be cleaned with sodium hypochlorite or ethyl alcohol after usage. Like if a patient has come now and there's been a usage of the table, so we make sure after the patient goes, we clean that part of the table to make it clean.
Okay.
And thermometers or other instruments which are used, they'll be thoroughly disinfected using alcohol again and before using it again. The waste like needles or syringes or cotton swabs will dispose according to biomedical waste segregation. It's a type of color coding disposal.
Okay.
And we at last we'll make sure that the waste goes to the specific waste handling team. So it goes to the team so that there won't be any spillage or any outside infection.
Okay.
So these are the things which we usually follow, and most of the other hospitals also follow the same thing. And what I recommend is, if you're going outside, don't touch anything unnecessary, and you should wash your hands or sanitize them regularly to keep yourself safe. That's what I recommend.
Okay. It was wonderful connecting with you, and thank you so much for your participation.
Thank you, Bharat. It was a pleasure talking.